So when we talk about a deep plane facelift, we undermine the skin here. And then at this green line here, this is where we jump into what we call the deep plane. So the deep plane is where we get under some of the facial musculature, and that way we're able to free up the ligaments that really hold everything in place here. So that's this ligament here, it's a ligament here, and there's one over the bone here. So when we free those up, you see that you require a lot less tension in order to get the lift that we're looking for. The control of the jawline and neck from a surgical standpoint is unparalleled with the deep plane facelift. It is the only facelift that can adequately lift the cheek or the mid-face meaning this area here. Additionally, it's the only one, like I said, that can really efface the nasolabial fold here or the marionette line here. I will admit it's more technically demanding for surgeons, so you want a surgeon who's comfortable with deep plane facelifting, who's been trained in it, and who's done a lot of them. And so you'll want to find a surgeon who feels comfortable going into this. And patients who get this done, as you can see, last I talked with the SMAS facelift was about 6 years younger. We have data to say these patients feel about 8.9 years younger. And so we typically will tell patients, with a non-deep plane facelift, expect to feel 5 years younger, and with a deep plane facelift, up to 10 years younger. And you can see this is why I tend to jump straight from the mini lift to the deep plane facelift if a patient needs it, because the vast majority of these patients, we're talking 98% of these patients, say it was worth the cost, worth the downtime, worth the recovery, worth everything in order to get this done. Here's just a couple examples from our group from the deep plane facelift. You see this patient had a very heavy neck. She did have some fine wrinkles in the midface here. She had a lot of loss of volume in the midface here. And post-operatively, her jawline is greatly improved. You can see this volumization here of the cheek. She looks great. And then same here. I like this photo because you can see she had a pretty significant pre-jowl sulcus here, pretty significant jowling. And she had some loss of volume in the midface, but nothing crazy. And you can see her jowling and her jawline is just greatly improved. You can see the wrinkling of the neck greatly improved. And we got rid of these platysmal bands here. She additionally had some submandibular gland fullness here, which we were able to kind of sling up with a facelift without having to remove the submandibular glands.